Hello, everybody. Thanks so much for joining us here at the Alberta Transplant Institute Seminar Series. We'd like to start by thanking the generous support we received from Paladin, sponsoring this seminar series. The University of Alberta acknowledges that we're located on Treaty 6 territory and respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. Very happy that you all have joined us today for a really interesting talk. This talk is called Organ Donation Following Medical Assistance in Dying, or commonly known as MAiD, Legal and Ethical Considerations. And our speaker today is Vanessa Gruben. Vanessa Gruben is an associate professor at the University of Ottawa, Faculty of Common Law. She's also a member of the Center for Health Law Policy and Ethics. Professor Gruben's research focuses on different topics in health law, including the legal and ethical issues regarding, of course, organ donation, assisted reproduction, and professional self-regulation. And she teaches different graduate and undergraduate courses in health law, public health law, as well as a seminar on access to healthcare. And her research has been funded by CAHR, the Social Sciences and Humanities Research Council, Canadian Blood Services, and the Foundation for Legal Research. So just in a second here, I'm going to pass the floor off to Professor Gruben, who is going to share her screen and give us a talk, and afterwards we'll follow it up with some Q&A. So feel free to leave some questions that you have in the comments, and we'll get to them at the end. And also feel free just to raise your hand at the end, and we'll get to your questions that way. All right, without further ado, I'll pass it off to Professor Gruben.
Thank you very much. It's a pleasure to be here. I am in Ottawa today on Algonquin territory. Very grateful to work, live, and play. I'm very thankful to the Algonquin people for their hospitality. So today I'm going to be speaking about some of the legal and ethical considerations that arise with respect to organ donation following MAiD. And this is an area that is a very interesting one and has lots of really interesting and difficult issues that arise in this context. And so I'm hoping to cover off a few of them. Certainly, if there's things that I haven't addressed during the presentation, very happy to address those during the Q&A period. I'm looking forward to our discussion then. Okay, so among the many questions that arose following the Supreme Court of Canada's decision in Carter and the introduction of the subsequent legislative framework for MAiD was whether organ donation following MAiD would be permitted, and if so, what that framework might look like, how we might structure that framework. Many have advocated for organ donation following MAiD, and perhaps no one has been more compelling than Dr. Shelley Sarwal. Dr. Sarwal was a Nova Scotia doctor who wanted a medically assisted death and also wanted to donate her organs. She was one of the first patients in Canada to do so, and she was the first patient in Nova Scotia to do this. And Dr. Sarwal was a patient partner with a group of clinical, legal, and ethical experts who worked together to come up with some guidelines that were published in June 2019 around organ donation following MAiD. Although Dr. Sarwal was one of the first in her home province to donate her organs, after undergoing the MAiD process, she wasn't the only patient who was seeking to do so. There was a number of MAiD patients who were inquiring about donation after MAiD, and they were an important impetus to developing those guidelines. On this slide is a documentary that follows Dr. Sarwal on her journey. If this is a topic that you're interested in, and you haven't yet seen this documentary, it's just a tremendous film, and I'd strongly recommend it for your viewing. It's on the CBC app. So there are a number of legal and ethical considerations that arise with respect to organ donation and MAiD. And today, my comments are going to focus primarily around sort of legal principles around autonomy and consent. So autonomy, the ability to make decisions about one's own health and bodily integrity, and also about the consent process, because there are a lot of questions about when and how consent should occur when we've got these two very important decisions that are being made about one's end of life care. Today, what I'm going to do is I'm going to frame my comments around these legal principles and some of these the ethical considerations that arise with respect to autonomy and consent in the context of an ongoing qualitative study that I'm conducting with a number of other researchers. And that study really seeks to learn more about the experience of healthcare providers, organ donation coordinators, and key stakeholders. And I find that their insights offer really important firsthand perspectives and guidance about some of the difficult legal and ethical considerations that arise in this context. They really nicely frame and illustrate some of these difficult questions. And so I'd like to take you through some of our findings, because I do think that they, as I say, really frame these issues up nicely. So before going any further, I want to acknowledge that research team, not doing it on my own. So Jennifer Chandler, H.T. Wang, Marie-Michelle Fortin, Matt Weiss, Simon Oskowski, just a great team who's been working on this project. So I'm going to spend some time going through what we've found, our preliminary findings in that study. And then I'm going to close today by just talking a little bit about the expanded framework for medical assistance in dying, because it raises some new legal and ethical considerations, many of which, we haven't yet resolved, but important to highlight them as we're sort of working through them. Okay, so let's talk just a little nuts and bolts about this study before I tell you the interesting bits. Methodology tends not to be the most interesting part, unless maybe for the researchers on the call, but for others, the methodology might not be the most riveting. So our study consists of semi-structured interviews. They've ranged somewhere between 45 minutes and an hour. Some of them have gone on much longer, like close to an hour and 15 minutes in length. And we've been asking our participants a range of questions about their experiences with organ donation following MAiD, about some of these difficult legal and ethical questions, what their views are on the risks and benefits of the process, the types of safeguards that they feel are appropriate, the nature of supports that are needed for families, organ donation coordinators, healthcare providers, and the teams who are involved in that process. And so we initially recruited our participants with the assistance of CAMAP, and we've also been using snowball sampling. So as people refer us to additional sources, we've been reaching out and conducting interviews with them. So today we've interviewed 24 participants, a range of different stakeholders that we've spoken to a number of organ donation coordinators. We've spoken to some physicians, both on the transplant and the donation side, although I must say it's mostly donation physicians that we've spoken to. We've spoken to some nurses, a few allied healthcare professionals. The participants that we've spoken to for the most part have been from Ontario and Quebec, although our study isn't restricted to Ontario, Quebec. It just happens to be that's where we've had the most success recruiting people for this study. Okay, so a nice range of different stakeholders. All right, so what have we found? What are some of our key findings? Well, first and foremost, many participants have indicated that patients who were considering medical assistance in dying were quite surprised to find out that they might be eligible to donate their organs. A number of our participants remarked that many people who have opted for MAiD don't think that they're eligible for organ donation. Even individuals who are suffering from chronic conditions other than cancer, really didn't think that organ donation would be an option because of their overall poor health. And so being approached about the possibility of organ donation following MAiD was something that our participants remarked was something that patients weren't necessarily expecting. And so, as I said, one participant really noted that the reaction of some of these participants is often surprise. Although they did acknowledge that there has been sort of mixed reactions when our coordinators have approached potential donors about this. So that really speaks to the need to raise awareness about this possibility for some patients. So what about benefits and risks? So the benefits and the risks that our participants have spoken about in this context really speak to a couple of things. The first is the importance of providing access to many patients who are interested in donating their organs following MAiD, but also the importance and the necessity of having appropriate safeguards in place to address some of the legal and ethical concerns that are unique to these kinds of decisions and the interaction of the potential interaction of decisions about organ donation following MAiD. So certainly in terms of the benefits, there are a number of benefits that our participants identified. Benefits to the recipients, there's an obvious medical benefit to the recipient who receives a donated organ. A number of our participants, almost all of them, noted that although the number of patients eligible to donate their organs following MAiD is relatively small, every donation really makes a difference, right? They just, they can't underscore how important that benefit is to recipients. I'm not a clinician, but from the participants that I've spoken to, they've also spoken about the fact that the organs from a patient who has undergone MAiD tend to be of higher quality because of the way that because the death following MAiD is quick. So important benefits to the recipients. Also important benefits to the donors. So participants noted that patients can derive important psychological benefits from donation, that something good is coming from an otherwise bad or unfortunate situation, and that there is a real sense of well-being that comes from being able to donate one's organs after MAiD. Benefits to family members as well. So the folks that we spoke to, spoke about the fact that organ donation following MAiD may assist family members with the grieving process. Knowing that there has been a benefit coming from the death of their loved one brings great comfort to family members. One donation coordinator that we spoke to told us about a family who, following the donation, expressed how proud they were of the fact that their loved one was a donor, stating quite, very proud that she was brave to go for MAiD and also be able to help somebody else through donation. So an important legacy for those family members. But of course, there are potential risks that have been noted and highlighted. The most common risk that was identified by our participants was a concern that the decision to undergo MAiD could be influenced by that intention to donate, right? That the interaction of those decisions could be concerning. So a number of participants, for example, worried that a patient might consent to organ donation because they don't want to let the MAiD provider down by refusing organ donation. They feel that that this is something that they should do because the MAiD provider might be expecting them to do it. There was also some speculation that patients might find it difficult to change their mind after they had consented to MAiD, so that once the process had been set in place, there was a concern that patients might feel pressured to continue with the process, that there might not be a lot of room for the patient to change their mind. So because of those concerns, there is the participants stressed the importance of ensuring safeguards are in place to mitigate against these risks, and ensuring that the decisions to undergo MAiD and the decisions to donate one's organs are separate decisions. Okay, so we separate that donation decision from MAiD. That removes that potential pressure that the patient might feel about the decision making in this context. Also ensures that MAiD providers are conducting an assessment of the patient, and they can ensure that the patient's not opting for MAiD because of the decision to donate. Right? We really want to keep those two decisions separate, and all of the participants that we spoke to really stress the importance of keeping these conversations separated. We also asked our participants to identify some of the barriers to organ donation following MAiD. And some of these barriers that arise are the result of legal rules. So it's important to acknowledge that. Some of them you can't actually get around, but it's important to highlight some of the concerns that might block access to organ donation following MAiD. One of the principal concerns that was that arose related to the over-medicalization of end-of-life care and death. And so one participant noting here, quote, "It's not a very calm and peaceful and patient-centered way of having the end of one's life, and especially for family members as well, if they don't have time to stay with their loved ones." And that's because for almost all patients who opt for organ donation following MAiD, MAiD must take place in the hospital, and we'll talk a little bit about that. There has been a couple of exceptions, but in the large majority of cases, this requires a medically assisted dying in hospital. So what is involved with over-medicalization? Well, first and foremost, the decision to donate is going to bring about a requirement for additional testing to determine whether the patient is eligible to donate and to ensure that the transplant is safe. So this is not necessarily, some of these may be legally based, but a lot of this is clinically, is rooted in clinical practice. And so the participants noted a number of different tests that need to be done in this assessment process. Might include blood work or chest x-rays. And our participants noted that this additional testing can be a barrier, or indeed sometimes a deterrent, to agreeing to organ donation following MAiD. For many patients who are opting to undergo MAiD, frequent hospital visits or additional medical testing, it just wasn't an option. And so we have a quote here from one of our participants noting that for this patient in particular, she was actually only eligible for lung donation. And so we wanted to have testing, and she'd been through enough. She was sorry that she didn't want to have any further testing. And so she declined the opportunity to donate after MAiD. As I've mentioned, because organ donation following MAiD does occur in hospital, the location and the timing of the person's death can be another barrier to organ donation following medical assistance in dying. So a number of participants noted that patients that they spoke with, they just didn't want to be in the hospital anymore. They didn't want to go back to hospital. They wanted to undergo MAiD at home. And a number of the participants noted that even patients who were interested, they expressed interest in donating their organs. Ultimately, they decided that it was more important to die at home than to undergo MAiD in hospital. Our participants also highlighted a couple of concerns and potential barriers relating to timing. The first is the potential delay that patients might face in order to accommodate the necessary tests and the questionnaires, so the medical and social history questionnaires. There might also be delays to allow the MAiD team and the donation team to coordinate the patient's end-of-life care. So, even though we have, organ donation following MAiD has been occurring for the past couple of years, it's not a new process. It's still relatively uncommon, and therefore there still needs to be additional planning between the MAiD team and the donation team, which can result in some delays. One participant also noted that there may be delays that occur during the MAiD process itself. In one case that this participant was involved in, there was about a 15-minute delay of the MAiD because the transplant team hadn't arrived, and the patient found that quite stressful. So important when speaking to patients and getting their consent in this context to really explain the process and the reality that sometimes things might be a bit delayed, so patients aren't caught off guard. Another suggestion that our participants had about how to address some of these barriers about sort of location and timing is the importance of approaching potential donors relatively early in the process. So many explain that patients really do a considerable amount of planning about the timing and location of their death, and they may find it quite difficult to revise those plans in order to accommodate organ donation. So having these conversations about organ donation early in the process is really critical to ensuring that patients, again, sort of understand what's involved and provide a really robust, informed consent in this context. So we asked in the course of these interviews, we asked some thorny ethical questions, and this was one that elicited some really interesting and difficult conversations, and that is about directed donation and whether directed donation is something that should be permitted in this context by a patient who's opting for MAiD and organ donation thereafter. There is quite a bit of uncertainty, I'll be honest, from our participants about how to address this question. On the one hand, some participants indicated that direct donation might lead to more pressure, more coercion. And so, like on the slide, I've got a quote. If you're talking about a relative or a friend, this participant noted that, expressed a concern that I think there's just that much more pressure or coercion, or even just a subconscious sense of like, I should probably do this. But on the other hand, participants noted that, directed donation is permitted under other circumstances. It's permitted in certain situations in the context of living donation. And, the participants noted that we could mitigate some of the concerns that healthcare professionals might have about obtaining consent from these individuals, and about these concerns about potential coercion and pressure. In particular, one of the points that was highlighted was the importance of respecting individual autonomy. So, individual autonomy has really been an important principle, not only in the court's recognition that MAiD should be legalized, but also in this context when we're trying to promote patient autonomy and to make a decision about whether or not a patient would like to donate their organs following MAiD, and permitting directed donation under certain circumstances may be consistent with promoting the autonomy of individual patients, especially here because you have an ability to get first person informed consent. You're asking the individual themselves. So, this is a really difficult ethical question that, we really heard from our participants about, how it's not an easy, not a simple, straightforward answer about directed donation. I like how one participant sort of summed it up as there should be more digging, and I think that's a good way to sort of capture some of the thinking about directed donation in this under these circumstances. So as I mentioned just a couple of minutes ago, this is certainly legally kind of an ideal situation for from a consent perspective, because consent is from the individual themselves. It's a first person consent that's being obtained. But the organ donation coordinators that we spoke to, highlighted that there are advantages, obvious advantages, but also some disadvantages associated with seeking first person consent from the patient themselves. We know that this is very different from the more common process where the potential donor is unconscious and the coordinator is in contact with the potential donor's family. So, one coordinator explained it's like an ideal situation, right? You have an ideal donor. It's very reassuring that you're getting first person consent. It's usually straightforward. The patient knows what their wishes are. As I said, certainly as from a legal perspective, this is sort of an ideal, with all these safeguards in place, this is a really ideal way of getting consent. The opportunity to obtain first person consent also lessens the burden on the family because they don't have to decide if organ donation is the right thing for their family member or not. So if there hadn't been previous discussions, for example, about organ donation, the family doesn't have to wonder. It's easier to have that conversation with the individual. But these interactions with the donor can make certainly providing care for these donors really quite emotionally difficult. And so, there's again, the quotes really are the best part of this study, to be honest. It really captures what's happening with that firsthand experience. So this particular coordinator met the patient a week before, had constant communication. And the coordinator felt like she lost a friend when the patient passed away. And that's not common in other kinds of donations, as you don't really meet the patient and you're only involved for a day or two. Whereas here, there is the process is longer, and you do obviously get to know the individual. So that really raises the question about the types of supports that should be in place, both for the healthcare providers, but also in place for family members. And there were a number of really helpful suggestions that arose in the context of these interviews. So for families, participants noted the importance of grievance support and spiritual therapy, stressed the importance of designating a support person to stay with the family following the medical death, the MAiD process. A couple of participants also noted that it might be helpful to connect family members with other families who've been through a similar experience. So having some support from folks who had similar experience. And then for healthcare providers, because this is it's a different process, and in many ways can be much more emotionally charged, the importance of debriefing following the procedure. That this can be something that's difficult for healthcare professionals and others to deal with. So debriefing was an important tool. Again, peer support. So there are peer support networks for MAiD providers across the country, having peer support networks for donor coordinators and other healthcare providers who are involved in these processes. Not only does that provide support, but it also provides an opportunity for, talking about how things are done in different jurisdictions, right? Similarities and differences, what works in different programs and in different provinces. Really building those networks can have a lot of benefits. There was also a number of requests for more education and training. So, having a better sense of what some of the legal rules around, getting consent and some of these other things, who has to report, where the responsibility lies for each part of the process. These were all things that came up in our conversations. So in terms of the next steps for our project, this is sort of the preliminary data. We're quite close to reaching saturation, but we are hoping to recruit another couple of people. If anyone on the call is interested in participating, please reach out to me, or if you know of anybody who might be helpful to speak to, I'd be very grateful if you could pass that along. And I don't want to talk too much longer, but I do want to highlight sort of the important next set of considerations that are arising in the MAiD context, and that's with respect to the additional categories of eligibility for MAiD. So although one of the common themes that we heard is that the number of cases of organ donation following MAiD are relatively small. They're really important, but they're relatively small. With the expansion of the eligibility criteria for MAiD, it's likely that we're going to see more individuals become eligible to donate after MAiD. However, the processes for MAiD are different, and it is likely that as a result, may be important to have different safeguards in place for depending on the context in which somebody is opting for MAiD. So without getting into too much detail about it, the sort of that second track approach where death is not reasonably foreseeable. There are additional safeguards built into the legislative framework. The eligibility assessments are much longer. There's a 90-day span between those eligibility assessments. That might provide more opportunity to speak to patients about their end-of-life plans and speak to them about organ donation. But it's important, and in a couple of years we will have some new legislation about individuals whose sole underlying condition is a psychiatric illness. So this area continues to shift and evolve, and the sort of legal and ethical safeguards around organ donation following MAiD will have to evolve along with this expanded eligibility. All right, so I think I will leave it there. I will stop sharing my screen, and thank you all for your attention. Excited to hear your questions.
Yeah, thank you so much for that talk. That was really interesting. I think as soon as I have the floor here, I'll just kick off with a couple of short questions if I can. The first one is, what did you see some more details around the lack of knowledge about eligibility? And I asked this because working with the team from Nova Scotia who's looking at the opt-out consent legislation change, what we've seen in social media as well as in some of the focus groups and things is that there's an assumption, just as you've already mentioned, there's an assumption that people feel that they're not eligible.
Yeah.
I was wondering if you, so the ones that we've seen typically are, some of it was joking, like no one's going to want my liver anyway, ha ha ha, that type of stuff. But then there was, some of that was kind of reflected in more serious ways as well. People just saying like, I think my body's basically no good anymore. And the other one, of course, was age. I was wondering if it's the same kinds of things you're seeing there or some of the details around that.
Yeah, so now just keeping in mind that our study, we haven't actually, although it will be fascinating to do this, we haven't spoken to patients themselves. So we're just gathering information from the folks who are interacting with them. But those are certainly very similar to themes to what we're hearing. So,
okay,
you know, individuals who are opting for MAiD, certainly most of the people that we've been speaking to was prior to the new framework. Many of our participants were speaking to patients prior to the new framework. So the eligibility criteria is quite narrow. And so the assumption was, well, if I'm eligible for MAiD, I'm in poor health, and therefore, how could I possibly be healthy enough to donate my organs? And so some people were very, as our participants characterized it, some people were quite surprised and very happy to have that conversation. And other people were just, you know, a bit flummoxed, right? So it will be interesting to see how that changes as the eligibility criteria expands and people who are less acutely ill become eligible for medical assistance in dying. I do think that this really speaks to the importance of education and public awareness about the option of donating organs after medical assistance in dying.
right.
It just puts it on people's radar, right? And yeah.
Thank you. We have a couple questions here in the comments. Marie Wilson's asking, is there currently available kind of a 1 to 5 page document to assist family members and legal advisors to kind of get things in order prior to arriving at a more short-term situation?
So in terms of, I'm just going to take a quick look at the question in the chat.
So, you know, I understand that to be, Marie, please feel free to elaborate on that. But, you know, is there something that's given to people as kind of like a primer, maybe earlier on in the stages to start prepping them?
That's a great question. I don't know the answer to that question, but I think that would be a really useful tool. It really speaks to sort of what Alessandra and I are saying about raising awareness and making these processes eligible or understandable and accessible to patients and their families. I think those kind of tools are really, really useful. You know, in Ontario, there is sort of a pathway document. It sort of summarizes the pathway for MAiD, and organ donation is, you know, where the organ donation conversations happen is sort of built into that step-by-step framework. But I think what you're talking about is something that's probably more patient-centered, if I was to guess.
Yeah, it's Murray here. Yeah, I mean, I'm not planning on dying immediately. However, I am an organ transplant recipient. My family kind of knows my specific interests. My lawyer has a very hard time figuring out what to do with my duties of care kind of documents, because I am interested in MAiD and donation. And right now, there's no place to go that I know of that allows both family members and family lawyers to sort of plan that path. Right. It's just sort of, oh, here we are. What are we going to do? How are we going to do it?
Yeah, there isn't, not that I'm aware of. That doesn't mean that there isn't something out there, but Murray, there isn't anything that I'm aware of. But I am actually taking note of that because I think those are the kind of resources that are really useful for people like me and other clinicians to work together to develop. So it's a really important point that you've raised. So thank you for your comment and your question.
Another question here from Andrew Masood. He says, thanks for the great informative talk. Are there any insights on the directed donation logistics around MAiD, especially among cases from Aboriginal First Nations patients? Any available data?
Yeah, so definitely no data. And directed donation is something, as I said, it's a really thorny question, and it's dealt with differently in different provinces in the living donation context. And at the moment, something that is recommended against in the MAiD context, but yeah, under the national guidelines that were prepared in 2019. It is a question, though, that James Downer and his team is in the process of updating those guidelines, as I understand, and it is something that was discussed in that context. So there may be further guidance coming, but no data that I'm aware of. It's a really directed donation from as a legal scholar is a really fascinating question. The conflict sometimes between consent and autonomy it's really starkly illustrated in that context. So, and as you can see from the participants, people who are working in this field also find those questions really difficult to deal with. So,
good follow-up question on the same kind of topic, expanded a little bit, I suppose. The interviews are with healthcare professionals. This is from Patricia Gongol. The interviews are with healthcare professionals rather than with patients and families directly. Do you think additional concerns would have been expressed from patients' families directly, thoughts that they wouldn't necessarily share with their healthcare team?
Absolutely. I think there is huge merit in doing a study that speaks to patients and family members. This is sort of our first entree into learning more about what's happening in the clinical context. I think there's little question that the follow-up study is going to be with patients and family members. I've done some empirical work with patients and family members around organ donation following for donation following DCD, donation following cardiac death, and you learn a tremendous amount, and you get a very different perspective from patients and families. That's really critical to be thinking about and talking about. So I do think we get some important insights from our stakeholders here, but no question, speaking to patients and family members directly is really important to learn more about, what's working and what isn't working, and what some of the areas that clinicians, lawyers, and ethicists need to think a bit more carefully about, and maybe change some of our approaches towards.
I imagine too, having that kind of data maybe informs what is given more ethical considerations or not, right? Because you can imagine something to be an ethical concern hypothetically, as in that it's possible to be an ethical concern, but it might not be expressed from people, right? So it would flesh that
Absolutely.
out.
Yeah, absolutely. There's no replacement for speaking to people who are actually living through these decisions, right? So yeah, you learn a tremendous amount from them.
All right, we got Chris Murray here. Thanks for the presentation. We have already seen a track 2 case in Calgary and have discovered wide variability interpretation of the 90 waiting period and the timing of involvement of the donation team. What are your thoughts on this point?
Okay, so this is where we're really at the sort of, cutting edge of the legal and ethical issues, and sort of how we should how these decisions about organ donation following MAiD should work. I think, overall, when we're thinking about organ donation following MAiD, it's important to be thinking about the legal rules and the ethical principles and all of those policies that apply to organ donation, and not get too caught up in some of the difficulties or some of the things that are working their way out in the MAiD processes, right? So there may be some things that are a bit difficult new in the MAiD context, and really sticking to kind of first principles with how we approach patients about organ donation, how we have those consent conversations, is really critical. I think in terms of the timing, we can certainly chat offline about sort of what the variability is, but I think certainly in terms of that timing, if there's variability, it really does speak to the importance of having conversations about organ donation early in the process. So, if a individual is, hoping to undergo MAiD, approaching them about organ donation early in that process is really critical, regardless of the variability of that assessment period, that waiting period. Making sure that conversation happens and that you can determine if that's something that the individual is interested in and wants, is really, really essential, even though you do have more time between the two assessments.
Right.
So a bit of a non-answer, but as I said, really just trying to speak to people early is really critical in this context. It's something that we heard repeatedly from participants, is, trying to approach people at the earliest opportunity, so that you can really make the decisions about organ donation separately from what's going on with the MAiD process.
Right. Maxine Chartrand has a great presentation. Have you researched how recipients feel receiving an organ from a MAiD donor versus a DCD or an NDD donor?
So that's a great question, and something that was discussed a lot when we were thinking about the 2019, pulling those 2019 guidelines together. There was a lot of debate about whether recipients should be told about whether the donor had the way the donor had died, whether they had undergone MAiD or not. And it was ultimately decided that, there are certain things that it's critical that the recipient know about from a medical perspective and should be advised about, but that the manner of death wasn't necessarily one of those things. So, for example, whether how the donor had passed away was not something that is typically disclosed, and so hasn't been done in this context.
I had one question to ask about, this idea of being pressured or potential coercion that's going on, and obviously that's a real ethical concern. Have there been any? I recall seeing, I'm not sure whether it was a year before, there was a legal case that came out of Holland, I believe. Am I right about that? About basically there was a lawsuit on this exact kind of topic. And are you seeing some of them or an increase of them? And are you kind of, obviously I'm sure you're watching some of that, some of those developments. I don't know if you have any thoughts about that.
So certainly in Canada, we haven't seen any legal cases yet. In this particular context, we are some interesting developments that we are seeing though, and again, I'm not an expert in this, but my colleague Andrew Healy has written about this, is changing some of the clinically, some of the procedures, the MAiD procedures. So for example, there's been one MAiD that has sort of been done at home. This has also happened overseas, done at home, and then the person is taken by ambulance very quickly to hospital, and it was a lung transplant case. It's sort of an individual case. So although we're not seeing legal cases, we are certainly seeing clinical practice evolve in this context, which is very interesting. And whether that eventually gives rise to some other legal concerns, I think it sort of remains to be seen. Yeah.
Right. Yeah.
But nothing yet in Canada.
Yeah. There's one other comment here from Michelle. She says, thank you so much for this. I'm an organ transplant recipient and my dad passed away through MAiD in May of last year. Feel free to be in touch if you'd like some perspective from my family member or someone who went through it, and they shared their emails. We can pass that on to you.
Thank you very much. I appreciate that, Michelle.
Well, we got one last question here. I think we got, yes, we do. We got time for one more, maybe one more after that. This is from Charlie Becolet. Are any amendments planned for MAiD in the context of cognition decline, e.g. being able to pre-plan the level of decline in which you would be ready to participate? It's an interesting question. I had this just discussing with friends a couple of weeks ago, the same idea about being able to stamp in a choice well in advance of different stages of your life and stuff.
Right. So almost, sort of this is, I think, the big advanced directive question, right? Like, can you figure this all out by advanced directive? At the moment, not. But as we've seen, there has been significant, we think about when the Carter decision was made by the Supreme Court, and then we had legislation, and we're already revising that legislation to expand eligibility in a significant potentially significant population. And again, in a couple of years, we'll see another increase in eligibility. So this is an area where the legislation is continuing to evolve to respond to the needs of Canadians and their decisions around their end of life care. So there's been a lot of discussion about advanced directives. There's been a lot of discussion about mature minors, and I expect these conversations will continue to occur. But at the moment, MAiD is not something that you can request by way of an advanced directive.
Any other questions from the audience? Or maybe I'll slip one more in just because I'm interested and I have you here. Is there anyone else from the public that wants to weigh in? No? Are we seeing any, I just haven't been following that closely. Are we seeing any pushback against the very idea of MAiD, that perhaps people would like to see it scrapped? Is that something that you've seen in either general social discourse or specific political discourse, maybe from opposition parties or different political members, MPPs or whatever?
Well, I think there was certainly quite a bit of debate about Bill C7. So the most recent set of amendments, I think the debates around the amendments to the original framework were quite, there's quite a number of important concerns raised. Sorry, I'm losing my voice. And some important proposed amendments that came from the Senate. So as I say, this is a legal area that's continuing to evolve. We're going to see a parliamentary review. We're going to see expanded eligibility, work around new safeguards for that expansion in a couple of years. And there are certainly differences of opinion and concerns that have been expressed by Canadians about this framework. But to date, the legislation has continued to evolve to expand eligibility, as opposed to, it's become more broad as opposed to becoming more narrow. So the Supreme Court's decision in Carter was very clear, a unanimous decision about the importance of permitting medical assistance in dying for individuals who have capacity. And so I do think that's having a legal framework that respects that decision is certainly here to stay. And as I've mentioned, it's continuing to evolve.
Yeah. One last final slipping comment here from Murray Wilson. I would like to think that advancing knowledge about tissue transplant, in addition to organ transplant, may stimulate further awareness of opportunities to donate.
Absolutely. And I should say so. When we look at the statistics about organ donation after MAiD, I don't have anything recent, but there are a number of individuals who also donated their tissues in that context. So it's not just organ donation, it's also tissue donation following MAiD. It's a very important point, Murray. Thank you for highlighting it.
Well, thank you very much. I think that brings us to the end here. So thank you very much, Professor Gruben. It's great to have you here. Next week at the ATI seminar, we're very pleased to have Dr. Dori Segev presenting COVID vaccination and the immunocompromised. So lessons learned from a study of 8,000 patients we never met. That's the title of the talk. And also a reminder here that the CDTRP has launched the Research Innovation Grants Competition for 2022. So that's with the support of Paladin. The ATI is delighted to offer 3 additional awards specifically to Alberta-based research teams. So there's a link available here in the chat that you can follow. The application deadline is April 11th, 2022. So if you're interested in that, do check it out. And thank you very much again, Professor Gruben. And thanks a lot for joining us. And we will see you all next Wednesday.
Thanks. It was a pleasure to be here. Sounds like an interesting talk coming up.
Yeah.
Thanks very much. Have a great afternoon.
You as well.